Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, and come up with, the same old. Doesn't work, right? Well, here's your opportunity. Here is the place that you get the answers. Without drugs, without surgery, how to turn your life around and take responsibility for it, because your health is a do-it-yourself program. And I want you to understand that, because ongoingly, if you don't take responsibility for your health, nobody's going to. And many of you already know that's the title of my new book, Health is a Do-It-Yourself Program, and you can get that by going to rosellecare.com. But having said that, we're going to talk about a very interesting subject, actually a couple of things today. And, have you ever found yourself waking up in the middle of the night and your hands are sore or your fingers are totally numb and you have to change positions or you have to move around, or you're sitting at the desk and you're working, or you're at home working, you're ironing, you're trying to pick up a book and the book falls from your fingers and you're wondering why, or you don't seem to have the grasp on something? Well, there's a problem with that, and it's not something that should be overlooked, and it's something that will get progressively worse and cause debilitation and cause atrophy of the muscles. And the medical intervention of what we're talking about is surgery. They don't do a whole lot more other than that. What am I talking about? I'm talking about carpal tunnel syndrome, or repetitive stress injury. Now, it's something that's kind of an enigma. The reason for it is simply this. When you're dealing with your hands, if they're not working, you got a problem, right? You can't do the work you need to do. You can't pick up an iron at home. You can't pick up a pencil. It drops out of your hands. Your writing gets terrible. Sitting there at a computer screen, trying to move a mouse around. There's a lot of things that we do on a day-to-day basis. Our cell phones try to text. In the world of texting that we have today, it's almost impossible when you consider that those little fingers of yours have to work. And pretty soon you look at your hands and you say, what is this deformity that's taking place? And you're told that you have arthritis or whatever, and it may be coming from something that's really straight up. And that's something that's straight up is technically called carpal tunnel syndrome, but it may not be, and particularly it may not be coming from your wrist. And we're going to talk about that in depth, because this Wednesday evening, the subject of our in-house continuing education program at the Roselle Center for Healing is going to be the why, where's, and how for, and how to fix carpal tunnel syndromes and repetitive stress injury. And the guy that's going to be your presenter is my guest today, Dr. Scott Lamp. Good morning, Dr. Scott.
Good morning, everybody.
How you doing, buddy?
I'm doing great.
Good. So we're going to put the fix on this thing. We're going to talk a little bit about what happens to people's hands, why their fingers go numb, and why they can't do the things. I mean, the other day I was going to pick up a glass in the kitchen at the office, and I realized that my hand wasn't working the way it was supposed to. And it came from the fact that I had hurt myself the other day doing something very common, but now I have a thumb that is locked up. I actually have a trigger finger in my thumb, and it's all stemming not from my finger or anyplace else. It's coming from the fact that I hurt my wrist, and I have a carpal tunnel type of condition. For our listeners, let's go through the process. I want you to take us through and really explain what this bugaboo is of carpal tunnel, what it really means, and we'll go from there, because it's a very interesting area, and it's one that costs people something in the neighborhood of about $40,000 per carpal tunnel problem over the that's before they do much of anything else. That's just with conservative palliative medical treatment, which means drugs and some physical therapy and the loss of work and so forth. $40,000 for a carpal tunnel problem, and that's without a fix. So let's talk about it a little bit.
Well, one of the things is not only that, for the industry itself, you're looking at about $20 billion that happens to the industry for people that are trying to work with workman's comp costs. So you've got those on top of that. When we try to look at carpal tunnel, the first by definition, usually you'll see 3.5 fingers. That means your thumb, your first finger, your second finger, and it may be possibly part of the ring finger. You'll have some numbness, possibly some strength loss, and by definition, those fingers will be affected, the tips of the fingers will be affected, and it's actually affecting something called the median nerve, and supposedly there's an entrapment on that. The problem is there's a lot of factors that go into this, and it's really a lot of factors why some of the failure rates are there, especially with surgery. They're looking at more than 50% failure rate, and even then, you got to get an aspect of what is success in a surgery anyway?
50%. So they're going to go in and they're going to start cutting on your wrist to try to fix a problem, and you come out 1 out of 2 chances that's not going to work.
Right. And it takes about 9.8 months, is the last statistics I saw, to actually recover from this. They're supposed to be going back to normal. And that's not really great, great recovery time. So there's other issues at play. Yes, there is carpal tunnel per se, but there's a lot of other things that are at play that also, even in your case, Tom, you've had some accidents. There's some issues that have been going on besides just, okay, this one day I go down and all of a sudden I feel like something's in my wrist. There's a lot more things going on. You got to look at past history and what am I doing with my body, especially the balance of my muscles as I sit, stand, or whatever I do in my everyday life that contribute to it.
Let's talk about the anatomy of this thing first, because we're talking about something that you and I understand intimately, that we deal with it on a day-to-day basis. But all people understand is that their hands hurt. They maybe get some atrophy. They get some numbness, in particular their thumb and their forefinger and so forth. And they look at their hands, and the muscle mounds in their hands aren't comparative one side to the other. But we have bones, and then we have muscles that go from our forearm into our fingers. We have muscles that just are in there in the fingers. But all of these guys can only work if the electrical system, the nerves that go to these muscles, work. And those nerves start in the spine and they start at the neck. So you alluded to the fact that I've had some injuries. I've had some pretty good injuries, particularly over the last 10 years. And I've damaged my neck and my shoulders pretty significantly. Thanks to you and the guys in the office, I function very well. Thank you very much. But when those nerves are pinched further up, or they're pinched in the shoulder, or they're pinched in the elbow, or they're pinched in the wrist, it can cause a problem all the way through. So injury and the predisposition of a carpal tunnel, repetitive stress injury, doesn't have to start locally.
Exactly. And I think one of the things is think of it this way. Think of those little fibers or nerve fibers that go all the way to your fingers. It's like a big extension cord from your fingers all the way up to the neck and to the brain. And I usually like to think of carpal tunnel as a multi-crush or multi-event that's different places are adding up, and eventually what it shows up in your hands. And so anywhere along that length of that nerve that goes all the way from the fingertips all the way up into your neck, anywhere I can pinch that or irritate it, or multiple places I can irritate it, all of a sudden I got irritations in my fingers. And so then you'll look at, okay, well, along this length, this cord, where are the most vulnerable places that could possibly happen? And where your body is less protected, when the nerve comes out from the spine itself, the wrapping, the myelin, that kind of works like a coating on your extension cord, is not as thick as it comes out, just as it comes out from the spine, as it goes farther down. So one of the first places we like to look at is really the neck, because that's the first place you're going to be irritating that extension cord.
One of the tests I do with patients when they come in, they're complaining of hand problems, is I have them approximate the thumb and the little finger, and I keep their arm perfectly straight, and then I pull against the thumb and the little finger and tell them, hold tight, don't let me pull it apart. And either with their palm straight up or their palm straight down, and often that thumb, that hallucis muscle, will weaken, right?
Right.
And so then I have them turn their neck one side to the other, and then I have them look down to the shoulder. And then subsequently, they have strength again. And they say, how did that happen?
Taking the pressure right off the nerve. And I think one of the things sometimes I have with people, too, is also not only that, I'll have them either stick their head forward and it'll pronounce the problem, and I'll have them pull their head back, and it seems to get better. So there's definitely a lot of things at play here, and that's one of them. You're pinching the nerve directly with your head position. So that means possibly a joint out of place, or there might be arthritis in the neck. There's something that's happening at that point that hits the vulnerable place and makes that reaction happen.
This Wednesday evening, people have the opportunity to get rid of this problem probably once and for all. And Dr. Scott Lamp will be your host at our office at the Roselle Center for Healing at 7:30 p.m., May the 18th. All you need to do to attend is call our office at 703-698-7117. That's 703-698-7117. Tell my staff that you would like to attend Dr. Scott Lamp's lecture. Here's the deal. If you have numbness in your hands, if you have the inability to grab like you used to grab, if you notice that certain positions are less able, it's less stable, don't put up with it, because what happens, it gets worse. And once atrophy occurs, you have major, major problems that begin to build and muscles that no longer work. The muscles of the hand are significant. And, we talked about them just a moment ago. I said to you earlier, I said helicis, that's not the muscle, it's the pollicis flexor muscle within the hand that is the one that we're testing, and one in the little finger as well. And that one's, for sake of argument, just called the digiti minimi brevis, small muscle, small little guy. I don't know how they came up with these names, but that's what it's called. Anyway, so you test these things, and if they're not working, there's a reason that they're not working. And it's usually because the nerves to them are being crushed, and you can have a carpal tunnel-like condition, but we have to look at the approximation of the hard structure, and that's what Dr. Lamp is going to be talking about this Wednesday evening, and show you how to fix this stuff, because, the truth of it is, the fix is pretty straightforward. It is not difficult. It's something that you don't have to put up with. Dr. Scott, the thing that has always impressed me is that you would think that this is a condition that guys out using their hands, construction workers, guys that are hammering all the time, they're on drill bits and things of that nature, they're the ones that have the most problem with this, but not so. Women are 3 times more likely to have a carpal tunnel problem than men. That amazes me. I never knew that, years and years and years ago, but I do, several years later than that, but 3 times more likely is like unbelievable to me. And what's the insight on that? Why?
Well, let's take a look at the one of the things that happens is not just an aspect of we're pinching nerves and things like this, but also there's other elements that can create problems for carpal tunnel, and sometimes they're not carpal tunnel. You've got other things you've got to eliminate. So I think the first thing when you look at, and it's also, I'm going to hit gender in a second, the first thing you got to look at is what other things predispose to make it look like this, but it's really not carpal tunnel. And it's a lot of the inflammatory things or things that help you retain water. And then that gets you into some of the female issues, because if you're retaining water, you've got this little tunnel where 9 tendons go through. And it's a thing that if you put more water into that tunnel, that's not going to stretch the tunnel out. The pressure is going to go inward. And when it goes inward, it hits the nerve. It actually affects the artery and the veins going to those tendons and nerves. And then you get a problem. So sometimes with the female issues, especially with pregnancy, you'll see carpal tunnel issues with pregnancy and they're retaining water. You better not believe you're not going to be getting surgery for that because of what's happening where they're retaining water. No, so there's some hormonal issues. It's
across the board with all kinds of things. Pituitary problems from injury to the skull, hypothyroidism, diabetes, inflammatory arthritis. All of these things can cause that tunnel that we're talking about, this carpal tunnel, this little canal within the wrist that the nerve goes through, to be compromised and cause compression. And there's actually another one that you and I know about, an ileocecal valve, and we're going to talk about that a little bit more. Mm-hmm. When we come back, we're going to have to break in a minute for some very important messages. However, I want to remind you this Wednesday evening, May the 18th, 7:30 p.m., Dr. Scott Lamp will be your host in our office, the continuing education program that we have. It's a freebie to you, but we do require a reservation. All you have to do is call 703-698-7117.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. My guest in studio, Dr. Scott Lamp, your host this Wednesday evening at the Roselle Center for Healing. Dr. Lamp is going to be talking about Carpal Tunnel Syndrome and repetitive stress injury and how to fix them, because 50% of you, even if you have surgery, will end up failing the surgery and you get the problem back again. Having said that, I want to remind you that time is moving very quickly, and September the 17th, Saturday, Ageless Health 2011, it'll be an event that will transform your health, your wellness index forever. We want you to be with us. We want you to be part of that. This is our keynote event. It's something that we do annually. Every year we change the information. Those of you who've been before, you know it is just really top quality. It doesn't get any better. You get a copy of all the information. If you want to take charge of your health, this is a program that you have to be present for. We will give you all the pieces. Ageless Health 2011 is better than ever before. In the last few years, it's been sold out, and we want you to be there. We're going to give you a special benefit. If you call our office at 703-698-7117 or go on to the website at rosellecare.com, that's ROSELLECARE.com, you can register online, and if you do it now, and if you register before the 20th of June, you can save 15%. This year we have a vendor that has stepped up to the mark and is going to be providing organic lunches for you as part of your registration fee. Don't hesitate. We're always sold out at the end, and those of you who think that I'm going to do extra things, in July or August, not this time around, because Connie and Dareth and Sue and many patients gave me all kinds of what for, and so now's your chance. You get 15% off. Give us a call at 703-698-7117 or go to our website, rosellecare.com. And by the way, you'll see the entire agenda there, and there's pictures posted. By the way, if you go to the right-hand column and you scroll down, you'll find Roselle Center for Healing, and you'll see pictures of last year's Ageless Health. There's about 13 of them posted. I think you're going to be impressed. We had fun. We want you to be there. Dr. Lamp, we've got a couple minutes before we have to break for news. Let's talk about this carpal tunnel type of thing that you're going to be dealing with Wednesday evening, because it's devastating and people put up with it, and pretty soon they can't use their hands. They think it's about arthritis, or that's what their doctor tells them that it is. But the truth of it is that one, it isn't. It can convert into that over a period of time. Any joint space that doesn't work, it's very costly, but it's highly, highly fixable. How do you do that?
Well, again, the first thing is make sure there's no other inflammatory things, and we already kind of went over that earlier. Make sure those other symptoms and those kind of things are put out of place. The other thing is when we do the treatment and going after some of these, what we're going to do is take a look from the neck all the way down. Look for when we talked about that, that extension cord. Make sure all the places from one point to the other point are working well, and making sure there's no abnormal muscle imbalances, and also looking for nerve entrapments all the way. So that can be from the muscles in the neck to the joints of the neck, to your collarbone, to a muscle in the chest, to ones that are in your elbow, to the wrist itself, and looking them all the way down there. And how we do that, we use some chiropractic techniques. We actually reset the joints, take the pressure off the muscles. We all use things like laser, which kind of helps settle things down, actually kind of heals the area and heals nerves. It's actually been approved by the FDA. If we need to, we got acupuncture that we can use. It's great for controlling inflammation. And then really look at the dietary aspects of what's going on. There's some other influences. Tom, you were talking about the ileocecal valve, that sometimes if that's not flowing well, fluid can back up in the system. Again, here's fluid in a trapped space that can actually cause some problems. So that would be looking at taking care of the pain. The last thing I would suggest to do is also, when you come to the class on Wednesday, dress comfortably, because we'll actually be moving a little bit there and showing you some things. The last thing is, what am I doing with my body, and what kind of postural changes that puts me into these kind of problems, and adjusting those things. We have a bunch of levers and pulleys in our body that we're constantly using, but if we put stress on them and overstretch a pulley, overstretch this, then it'll have consequences. Even the hamstrings and your back, your curvature of your body will compensate up in your neck.
Well, we're going to get into that very specifically when we come back from the news. And I'm going to talk about a little-known cause, something that you wouldn't even begin to think that could cause an ileocecal valve problem. And I'm not even going to let you on, but I'm going to tell you that this is something that, if it's fixed, the problem often goes away immediately, sometimes overnight. You're listening to Dr. Tom Roselle Live. My guest, Dr. Scott Lamp. We're talking about carpal tunnel problems.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind, not only the one that we're talking about, which is Carpal Tunnel Syndrome, but whatever you have that is bugging you, and if I can put you in a better direction, I'll be happy and glad to do that for you. Ongoing sponsor of Dr. Tom Roselle Live, as you know, is Thermography Centers of Fairfax. And during the month of May, in regards to all of you, mothers and our military, Thermography Centers of Fairfax is giving you 20% off of any thermographic scan. Call Dareth Painter at 703-943-7248. That's 703-943-7248. And get it done. All you have to do is schedule it this month, and that 20% off is yours. What a better way to have information that you can have to preemptively handle things that are going on in your body. Thermographic imaging will show up the beginning stages of cancer 5 to 8 years before it can manifest on any type of diagnostics other than this. The reason for it is because it shows the beginning stages of what we call vascular neogenesis. It's the beginning stages of the blood supply that is going to supply the tumor. And if you know that's happening, the body is extremely forgiving. You can turn it around. Thermography Centers of Fairfax, 703-943-7248. Talk to Dareth Painter and get 20% off on the month of May. Dr. Scott, this just reminded me. Here's the deal. You go into a doc and you say, my wrist is hurting, my fingers are numb. And if you use thermographic imaging, you can actually find out where it's coming from, whether it is in the wrist, whether it's in the elbow, whether it's the neck, and confirm other types of diagnosis that we use with X-ray and orthopedics and neurology and muscle testing and so forth. Yeah, and I think you actually stole my thunder there, Tom. One of the things with that is that you can see that in the neck. You can see what muscles are overworking. We talked about levers before. They're going to be overworked. And you might even see, like I said, there might be things even from the low back going up. Let's say I'm leaning forward in my job for a long period of time. And also in my compensation is my neck. It's going to show down even things like in your low back. So you'll see those spots that are where the muscles are working really hard. One of the things that's interesting about what happens with postural changes in the body and the muscles become imbalanced, the body will constantly compensate without pain yet. It'll compensate. It'll recruit some other muscles along the way. But the thermographic scan is going to actually show it like, wait a minute, there's a hot spot here. It might not be painful yet. If you push into it and look into it, you might find it. But it might not be painful just yet because the body wants to keep the pain threshold down and not alert the computer, which is our brains. But you bet, you can really see a lot with a thermograph. The interesting thing about thermography is it points out the increase of inflammatory reactions within the body. Inflammation is pain, pain is inflammation. They feed back onto each other. And when you can identify sources of inflammatory reaction within the body, it gives you a clue, if you will, that you have a problem that you have to deal with immediately. And if you put out the fire, if you put out the inflammatory level, things go away. And that brings me to what I talked about just before we broke for the news, and that you and I are very, very well of. There's a little-known cause of even most practitioners, even do conservative care, of carpal tunnel problems. It can affect both hands. It can affect one hand. Usually dominant hand is the one that's going to be the most affected. But it's something that we call ileocecal valve syndrome. And what that means is where the large and small intestine come together, there's a valve. It's not a valve like you turn a faucet off and on, but it's 3 muscular rings that allow food once digested from the small intestine to pass into the colon, into the large intestine. And sometimes these 3 muscular rings, this valve, if you will, doesn't completely close. It becomes somewhat incompetent, and you backflush toxin from the colon. Now, this valve, like everything else, has innervation from the low back. It has innervation from the acupuncture system, the large intestine, and the small intestine acupuncture meridians, because that's where it joins. There's multitudes of things, allergy reactions and so forth and so on. But if you clear this up, if you close this valve, and we do it manually, and we do it with nutrients like chlorophyll, you take away anything that's irritating from the system, particularly things that are hot and spicy and rough and so forth for a period of a couple of weeks. And it's almost like miraculous, and you see this thing go away, and you add things that decrease swelling, your anti-inflammatories, B6, particularly the phosphate form. But we see this all the time.
Yeah, I think one of the things, it's chemical sciatica. Tom, you've probably run across that, where you got somebody with back pain and it's shooting down the sciatic pain, even though we're talking about carpal tunnel here. I've seen that tremendous results with that, because what happens, think about the fluids backing up, and it backs up in the disc gets inflamed, it's right there near the low back. There you got it.
It's amazing to me. You know, I've been in practice 35 years, and the longer that I'm in practice, the more that I teach, the more I share information, the more that I'm aware that health really is all about the things that we've been doing. I was listening to some CDs that I got many years ago. There's a guy by the name of Robert Young. He's a brilliant microbiologist and PhD in human biology. The guy is one of the most knowledgeable in the area of acidity, and most of our problems, including carpal tunnel problems, come from a place of inflammatory reaction and weakness within the system. And what happens is our body goes into a phase of we try to get rid of certain things, and we can't do it after a while because it becomes a chronic source of irritation. Then we go into trying to get rid of these things, but they're showing symptoms at this point. And then from there, it begins to build up all the joint space damage and so forth. Then we compensate by doing other things, so we put stress on other joint spaces. And then, but because of that, we start seeing degeneration. This is where the osteoarthritis comes into, and the premature aging, and the memory losses and so forth. If we want to extend it to that level, and then pretty soon the pathological stage, where we actually see the hardcore evidence of damage, in some cases cancer. And when we have a long-standing problem with us in a joint space, like we're talking about with the carpal tunnel, it can cause those tumors and cancers, and it's an inflammatory cycle, and you have to shift. You got to fix the mechanics, but as you know, chemically, you have to alter the terrain, the biological terrain, the environment of the patient.
You bet. And I think, again, think about inflammation. The body wants to try to handle inflammation. It will actually withhold water. And I think a lot of times, trying to hold that water in can create compressional problems, and again, that will fall into this carpal tunnel thing. I get excited when I go in to see a patient, when I see these things that can be turned around. I'm talking about a carpal tunnel, and patient has lost the ability, or they can't stand the pain. I see them walk in with these hand braces, and I ask them the question, how did it start? So, well, it started on my right hand, and I had surgery on it, but I still have problems. I have to wear this, and some months later, it started on my left hand. So they're right-handed, and they're using everything the right-handed, and, I said, well, what have you been told? And they said, well, I went to my doctor, and he said that it's really because of my age and that I've, been breaking my wrist down. And what it comes back down to is a statement that I laugh at all the time that one of our colleagues, Dr. Sushil Sims, always says, and he usually talks about it when it comes to a knee in a physician. He said, but, are your both hands the same age? It's like, one's good, one's the other. It's funny. But nevertheless, age is not a thing. It's injury over time and damage and mechanical instability and all those things that just don't work the way they're supposed to. And if you cut them and if you drug them and you keep the inflammatory levels as high as they have been, the problem just continues to persist. Yeah, and we're just doing symptom chasing. Again, this is multiple systems, and that's the way we're going to talk about this on Wednesday. You're going to be looking at, one is the chemical systems of the body, the inflammation, as we've talked about. Look at the structural systems that play a part. And then the adrenal system plays a little part in this, too, because that actually has information in regards to how to handle inflammation. So all three of those can play a part. And I think we just need to, look at those and combine those systems and make it unique for each individual, too, by the way.
In this environment, in this culture, we're seeing more and more of these things take place over time. Obviously, lifestyle has changed, and we have a lot of more conveniences that are available to us, and we use our hands ongoingly. But nevertheless, it's because of the body mechanics, the terrain, the environment that continues the process. This Wednesday evening, Dr. Scott Lamp is going to take this piece by piece. He's going to dissect it for you, so to speak, and show you how you can recover, you can put things back together and not suffer with numbness and tingling and inability and dropping things and so forth, and your doctor telling you, well, you're getting older and that's why it's there. Well, you know what? It's injury neglected over time, and we've got to be able to put that into a better perspective. Let's go to the phones just for a minute, but for this Wednesday evening, I'd like you to attend. I'd like you to be there. I think you're going to learn a whole lot, and it'll give you an opportunity to figure out what you can do about it. Call our office at 703-698-7117. The Roselle Center Healing will be sponsoring this presentation. It's free to you, but we do require reservation. Rodney, how can I help you, sir? Thank you for calling.
Doctors, how are you today?
Doing well, my friend.
Good.
I was calling because I had a scenario that developed probably some 12, 13 years ago from a traumatic injury from a vehicular accident that really went completely untreated for the first 5 years of that scenario. And it was only approached with non-invasive surgery. There was some chiropractic treatment early on. And since that time, I've seemed to have developed, I'm a 54-year-old male, by the way. At the time of the accident, I believe I was 30, I was actually 41, so that's almost 13 years. At any rate, I wanted to ask Doctor about the possibility of that chemical sciatica or maybe being triggered by an allergic or acidic environment. I certainly watch what I eat, but there also might be a scenario that was probably caused by the extreme cold winter that we had. Actually, I pulled a muscle in the late part of August, but the entire winter just got worse and worse and worse. It was unbearable.
Rodney, let me ask you a couple questions definitively. When you get the pain in your leg, does it go down the front, the back, or the side of the leg?
Actually, the back, Doctor. The left, the back, the hamstring area.
Okay. What makes it worse? If you're sitting, standing, walking around, what position?
Yeah, that it was such an evasive pain. It would be particularly bad in the mornings when I got up. I thought it might have been my sleeping surface. Might have been something with that.
And you say that's triggered with cold temperature shifts?
Yeah, definitely. Lately, after the extremely cold, brutal winter we had, and I don't own a vehicle, so I'm forced to walk and rely on public transportation. So basically, had to control that with NSAIDs, and doctor finally agreed to put me on a mild painkiller.
Okay, a couple things come to mind very, very quickly. And what those are is this. When you wake up in the morning and you have pain before you even get out of bed, you're in a different posture position laying in bed. So it tells me that mechanically the structure is being compromised by the position that you're in. So you're...
think it's related back to that injury?
It could very well be.
Mm-hmm.
And so the nerves are being crushed or pinched while you're sleeping.
Right.
And so then if you get up and you move around, you warm up, you take your shower, you feel better.
That's right.
That's strictly a structural...
I had to rely on Epsom salt baths in order to get any relief.
That's a structural problem, Rodney.
Right.
And it's something that can, if it's evaluated properly, and at this point, structure breeds chemistry. Chemistry begins to perpetuate the structural problem. It's inflammatory to structure, structure to inflammatory.
Last quick question. Would you suggest chiropractic treatment?
Absolutely. First before everything else.
Right. Thanks so much, Doc.
You're welcome, my friend. Thank you for calling.
Bye-bye.
Diane, how can we help you?
Yes, hello. I have AF, and I've had an ablation done, and I'm on Lasix daily, and I'm on Topro, 25 milligrams of that. My legs are always filling up with fluid. I have to take the Lasix every day. It seems to be getting worse. I'm always very tired. So, I just don't know what to do anymore, if there is anything.
When were you diagnosed?
About 5 years ago.
And what did they tell you at that point?
Well, this is after I had the ablation. Well, they told me I'd be okay after the ablation, but my legs fill up with the fluid.
Okay, atrial fibrillation is basically a misfiring either of the nerves that go to the heart, and you have three different sources of electrical stimulation to the heart. You have the pacemakers, you have the nerves from the back, and you have the nerves from the neck. And I'm going to hold you over, Dan, because I want to answer this question for you. We're going to take a break in just a second. But it's when these things misfire or the nutrients themselves, particularly potassium, magnesium, and sodium, are out of balance, then the heart muscle is not going to receive. But you have to find out a lot of things, whether the heart is actually receiving the stimulation and not able to to conduct it. So we're going to take that up when we come right back. Don't go away, Diane. I want to take this question.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live, and we have been live in studio at 888-630-WMAL. My guest, Dr. Scott Lamp, who will be your host this Wednesday evening at the Roselle Center for Healing, May the 18th, 7:30 p.m., and he's going to be talking about carpal tunnel syndrome and repetitive stress injury, but more importantly, why they happen. And I think that many of you think it's just in the wrist, and it's not. It's if you're having problems with neck, shoulder, arm pain, hand numbness, and tingling, you're dropping things. It tells you that the problem is not necessarily a local thing, but you got to find out why it is and where it's coming from to fix it. And this is the guy that's going to put the magic on it. He's going to show you how to fix this. Call our office, 703-698-7117. Tell my staff that you'd like to be there, and I promise you, you're going to find information that can help you. He's going to show you how to prevent it, and he's going to show you how to fix it. Let's go back to the phones. Diane, thank you for holding. I'm going to try to make this a little quick, unfortunately, simply because I don't have a lot of time. And if I have to drop you, which I will in about a minute, you can get a hold of any of my staff member or get hold of me online at rosellecare.com, and I will write you back. So when you're dealing with atrial fibrillation, you have to look at all the circuits that are involved to the heart. You have to look at the three sources of electrical input, the vagus nerve from the brain, the parasympathetic nerves from the spine, and then the pacemakers within the heart. You have to look to see if the nutritional components are adequate and they're not being imbalanced with something else. You have to see if the muscle is being able to react. So you have to look at the things that support mitochondrial function in the body. You have to see if there's any damage there. You have to look at the acupuncture system. The acupuncture system is so important when it comes to anything to do with the heart. And so you put those pieces together. Topiral, unfortunately, has all kinds of side effects, and it doesn't really do much. Ultimately, they go from that, and then the next thing they're going to want to do is get you into a pacemaker. Before any of that happens, I would encourage you to have this evaluated, because we see patients with this all the time. And if you can identify the process and you make some shifts biochemically and neurologically and you can be treated properly, magic does happen. Diane, call me or talk to me either by the computer or come in and make an appointment and have us check it out. But I think, before anything else, it's at least worth the conversation.
Okay.
Okay?
Thank you.
Diane, thank you for calling. I wish I had more time, but get a hold of me and we'll chat, okay? Bye-bye. Dr. Scott, real quickly, let's talk about what you're going to do this Wednesday evening and who should be there.
Okay. Well, first off, we're going to talk about why you possibly could have these things. Make sure we rule out those things that could mimic this. The third aspect, treatment protocols. Some even basic stretching I'll show you. That's why I said you should actually have something comfortable to wear. And then also take a look at some of the things in regards to what kind of structural things, what are we doing to ourselves. So anybody who's a computer operator, if you've got a laptop, you usually have a problem. That's a very bad piece of equipment, and because it's just it's an ergonomic nightmare. So unless you add some tools to that to make it work for you, if you're a laptop user, come in and find out what you're supposed to do with that machine.
I've got a guy here that's going to be lecturing to you and teaching you and showing you how this Wednesday evening. And this source of information is unbelievable. Half the time I got to stop him in the office because he gives so much. And if you really want to learn about this thing and what to do about a carpal tunnel repetitive stress problem, numbness, tingling, dropping things, pain that you've been suffering, and so forth, this is the go-to guy. So give us a call at 703-698-7117. We're here every Sunday at 12 noon trying to give you insights and differences, things that you can do for yourself to help yourself, because you are truly the captain of your own health and your own wellness. Health is a do-it-yourself program, and my dedication is always to you. You can give us a call at our office at any time or get me online at rosellecare.com. I will be here next week. See you then. Bye. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, rosellecare.com. That's rosellecare.com. Hi, this is Dr. Tom Roselle. If you're looking for a wellness and healthcare environment to showcase your business, products, and services, consider being a wellness partner of Dr. Tom Roselle Live and the Roselle Center for Healing. From in-show advertising to on-site events and digital marketing, we have several offerings that can highlight your business with a well-received and established audience. For more information, visit WMAL.com, keyword Roselle, that's ROSELLE, and click on Become a Sponsor.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.